Sports Medicine, a day in the life of Dr. Richard A. Martyr.
In an average working day, I attend to the scheduled appointments of my patients and graph new charts for my new patients. Sometimes all that is necessary is to talk with the patient and or with the parents about the injury, and I inform them of the many risks that might come with surgery or with continuing to play a sport while they're injured. I often help my coworkers as well if they need help assessing one of their own patients. I always knew that I wanted to get my doctorate, but a good acquaintance of mine suggested this field to me. When I began studying it, I fell in love with learning and how people recover from their sports injuries. It is a perfect job for me, and I love it.
These are just some of the many wise words from Dr. Richard A. Martyr. It's also said how the emerging jobs that come out of sports medicine are physical therapy, sports med physicians, athletic training, coaching umpires and sports officials, and sports psychology. He also recommends doing internships with doctors in similar fields to sports medicine because it's a good way to get your foot in the door.
On the completion of a residency program, candidates apply for sports medicine fellowships. Fellowships can last between 1 and 2 years, and after which the candidate must take a subspecialty exam in sports medicine to become a sports medicine physician. Sports medicine specializes in the prevention and treatment of injuries that result from athletic activity. These medical professionals treat disorders of multiskeletal systems, which involve ligaments, bones, muscles, as well as chronic conditions. They often focus on either general sports or medicine or orthopedic surgery. Experience in these fields are very important and beneficial to sports medicine. He says that for skills and abilities, he thinks you have to be a calm person to know how to deal well under stressful situations. He says if a patient comes through the door needing immediate care, you have to always be quick and assertive. You cannot stress yourself out. Some benefits you can get are life insurance, workers' comp, tax saving, medical and dental plans, child health care reimbursement, medical liability insurance, tuition aid plan, education and travel funds, professional fees, lab coats allowance, laundry for lab coats, and there are many other types of benefits. Although you should not get a job for the starting salary for a sports med physician in the United States is $214,249. Some technology used in sports medicine are X-rays, multicellular ultrasounds, planet-rich plasma therapy, concussion studies, and there are many other types of technology used in sports medicine. If what you want is to become a doctor, you have to work hard and study hard. To be a full-time sports medicine physician, you have to work at least 30 hours a week. Dr. Richard A. Martyr is always rewarded when he sees his patients healed and healthy. He says it is the most accomplished feeling. A painless patient makes a happy doctor, he says. Dr. Richard A. Martyr takes his job serious. He's 59 years old, and he has a daughter and a son. He and his wife are always telling their grandchildren how to take precautions during their sporting events. Unfortunately, he can only make about half of the sporting events, but he's always impacted by telling them how to take precautions during their events. He is a great role model to look up to during sports medicine. In conclusion, sports medicine is very necessary in today's society. People are always getting hurt, and doctors are always being needed.
Here's a few tips on how to avoid some sports injuries.
Avoid twisting knees by keeping them as flat as possible during your stretches. When jumping, land with your knees bent. Do not overwork yourself. Always warm up and cool down during and before any exercise whatsoever. Always follow the safety rules and procedures. Always wear your proper gear, and always use equipment in the exact way ordered.
It is highly recommended to be a sports medicine physician.